everyone, welcome to Follow Your Heart here on the Natural Parent Magazine. I'm Anne Cullen, and today my topic is breastfeeding. In particular, I want to talk about supplementing the breastfed baby in the early days. So first we need to understand what the stomach capacity of your newborn baby is. Let's start there. So I've got these lovely felted balls that kind of give us an idea of about how the stomach capacity changes over the first week of life. So on day 1, day 2, your baby's tummy holds about a teaspoon of milk. That's all. Day 3, we're looking closer to a tablespoon. Day 4, we've got about an ounce here, 30-40 mils. That's all. And then at a week, that's when you're getting into a little bit larger, maybe up to 60 mils, maybe 2 ounces at the most, okay? So when your baby is being supplemented in the very early days, and this, I'm obviously talking about the first week, this is what happens frequently, and we all have a different birth experience. Whether you're having a home birth or hospital birth, you might have different circumstances and feel a bit of pressure to be supplementing your baby if breastfeeding isn't going well in the beginning, if it seems like your milk hasn't come in, and if there's some concerns about baby. Now, what I hear very, very often is on day 2 or 3, a lot of times baby is given a couple of ounces, more like 50 mils, so maybe that's an ounce and a half. And that's quite a lot. And sometimes bottles are being used for those supplements, even in the very early days. So let's talk about amounts first of all, you know, coming back to that stomach size, remembering colostrum that you have in those first 2, 3, 4 days is very, very rich, and you can see why your baby wouldn't need lots and lots of it at once. So your baby's tummy is you know, a tablespoon at most to fill up your baby's tummy in those first couple of days. A tablespoon of milk. So, and of course this can be done, it doesn't have to all be in one big go. This is why it's best to have your baby on you skin to skin, really living there at the breast. And as I've said before, when baby comes out, they've gone from this place of constant nutrients, receiving constant nutrients through the umbilical cord, to now needing to be almost constantly at the breast. So getting in those lovely, comfortable, more laid-back, semi-reclined positions, keeping you and baby together, skin to skin as much as possible for the first day, 2 days, 3 days, that whole week, whatever you can manage until you know that breastfeeding is really coming along and that baby is beginning to take some milk. Now, if there are concerns that might be out of your control, especially if there's a mom and baby separation or, you know, some sort of different scenario happening, let's talk a little bit about different ways babies can be supplemented. So obviously, we're all very aware that bottles are often used to give babies milk, whether it's formula, expressed milk, whatever it is. But it's really very unnecessary for at least the first week to even go down the bottle route at all. And so I'm really just talking about the first week here. Remembering again the very, very small size of our baby's tummy and where they've just come from. They're used to kind of that constant flow of nutrients, right? Not just a big 50 mil or 1 ounce feed. So we want to be offering it nicely and slowly and gently. One of my favorite ways to do that is we can just express some colostrum, and this is where learning to express before you have your baby, practicing for the first couple of, a couple of weeks before babies do. Learn how to kind of express just a couple of drops of colostrum out. Sometimes you can be expressing that colostrum, and baby can literally just lap it up from the breast without having to do much to get it. We can also put it in a spoon. That works really, really well, and baby sort of laps it up from the spoon. Or there's cups. You can use a shot glass for this if you're at home. There are specially designed cups that have you know, kind of a slanted rim. There's all kinds of ways, so it might be something you want to Google. I don't have those here. There's another way, especially once the milk has more come in and you are able to get a more liquid milk. I've got, this is called a French number 5 feeding tube. So it's literally a feeding tube that's used, and if you have some expressed milk that you can put into a container, doesn't have to be a bottle, it can just be a cup, and you put one end of the feeding tube into the container where the milk is, and then this end goes into the baby's mouth, and it just needs to go in teeny tiny bit, about 1 centimeter. There's a couple of little holes there, and one of the best ways, easiest ways to do that is because of baby's sucking reflex. If a finger goes into baby's mouth, of course clean with the fingernail cut short, finger goes into the baby's mouth, the pad side, you know, up on the roof of baby's mouth, the nail side down on baby's tongue, baby starts to suck. And that's when you can slide the tube in and you'll see the milk coming up through the tube, and it's what we call finger feeding. So we've got also some syringes. Sometimes babies are syringe fed. There we need to be very careful again about being very slow, being very gentle, really following baby's cues. So supplementing in these ways is really protective for your breastfeeding relationship, and it also doesn't overfill babies. So we want to keep those amounts really small and be a bit creative with how we are supplementing our babies in the very early days, especially if you're not planning to bottle feed your baby. If you're planning and hoping to breastfeed your baby, stay away from the bottles. It's just really not necessary. So I hope you found that helpful. Please let me know if you have any questions or how you've supplemented your baby that needed supplementation in the early days. We'd love to hear what you've experienced. Thanks for joining, everyone. Bye.